pediatric pediatrician and a neonatologist working in Andheri area. I am owner at Swastik Childcare Clinic, Andheri East. My area of practice includes Andheri Jogeshwari East, Marol and Ville Parle East and Andheri West. I have been associated with BSCS Brahma Kumaris Hospital, Gaude Hospital, Medicare Marol, Swapnapurti Hospital, and in various capacities. Right now, my main focus is on my Swastik Childcare Clinic. It's a OPD clinic as well as with an emergency bed. Today, our topic for discussion is how to introduce baby to new foods, especially at 6 months of age when the weaning starts or complementary feeding starts. So, uh, healthy, nutritious diet is basically a basic requirement like roti kapda makan. Roti is the first thing. That way, it's a nutritious diet is a basic requirement for any growing child. It lays the foundation for the future healthy habit eating habits. Especially the key question is when to start. So ideally, weaning should start when the mother is about to join for work. So 2 to 3 weeks prior, when mother, because we are living in a working environment where mother needs to join a job. So 2 to 3 weeks before the mother is planning to join her job, the child should be started to wean. Uh, Ideally, it should start at 6 completed months. That is when the seventh month starts. But if the child shows certain signs, like a baby is breastfeeding frequently and he seems unsatisfied, or the formula feeds, he start consuming milk with more than 1 liter per day, or he shows interest in food when the others are feeding or eating, these are subtle signs that the child needs more than just milk. Okay, so ideally 6 months, but at least after 5 completed months. Weaning should actually be flexible and not like a military schedule. It should be individualized for each child. It should be a happy and an exciting thing for both the parent as well as the child. Should not be a monotonous and a war between a mother and a child. All right. When exactly do you start? So 5 months completed and at 6 months. What do you start with? How do you start with is the question. So first, we'll talk about how do you start and what do you start. So the basic principle involved in starting the feeds is first you give liquids, then you try solids, semi-solids or mashed foods, and then you go to solid. Basically, increasing in thickness or quantity, thickness and quantity. In fact, so at 5 or 6 months of age, choices again varies with families and cultures, because every culture has different staple diet. So you can begin. The idea of starting feeding at 6 months is that by 1 year of age, the child should be able to eat from the family basket. That is, whatever is cooked daily or regularly in the family, the child should be able to eat. Okay, so first, as I said, we go from the thinnest consistency to the thickest. So first we begin with liquids. So either dal or rice cereals or vegetable broths. So first thing in India, usually we start with a rice moong dal combination, or first moong dal or dal ka pani is what we call. So you go with the thinnest part of the cooked part of the water, which is cooked, used to cook the dal. That water you start with. Then gradually you add moong dal to it and increase the thickness of that moong dal. This thing. Then you add a bit of overcooked rice to it, and then that's how you start feeding. No added salt, super added salt or sugar to be added till at least 1 year of age, because that will help them grow properly and decrease the risk of lifestyle diseases later in life. The salt later is the super added salt introduced, the better. Same with the sugar thing and honey. Okay, after you start these dals, rice and moong dal or tur dal or other things, then we go to mashed foods. So first you give mashed foods. May you can give fruits as well as some vegetables. So 1/4 of a banana you boil and give. 1/4 of apple, one piece of apple peeled and this thing. Uh, you can give papaya, you can give potato, you can give sweet potato, you can give chiku, you can give mangoes, all these in mashed form. After the child starts chewing, or at least chewing and swallowing, Then you can make the consistency a little more harder for him to chew. Once at 6 7 months, even the first milk tooth starts appearing in most of the children. So then you can increase the thickness. Apart from this, you can also start vegetable soups: carrots, pumpkin soup, dudhi soup, beetroot, tomatoes. Again, in increasing thickness, first very watery, then a little more substance, then a little more, and then the thickest soup. Okay. Other home cooked food that we use to start weaning are firni, which is a rice powder plus milk combination in many households. Rava kheer, shira, nachni satwa, suji, other things, and fruit juices. The fruit juices again is a little this thing, because fruit juices are too sweet. So if you introduce that at first, then later on the child will not have the other foods that he's supposed to eat. So fruit juices should be given as a booster dose when the child is not eating, just to sweeten his mouth, and then in between the feeds. That's the whole idea. All right. Now, this is what you give, how you go about increasing. Okay. In general, you start how. So, what are the feeding schedule? Feeding schedule is again not to be military. You have to have 2 to 4 solid meals and 3 to 5 milk meals. So till 6 months of age, child is on exclusive breastfeeding. So suddenly to shift from milk to solid will be a tedious effort for mother as well as the child. It's traumatizing sometimes for child when you are force feeding the child. So 3 to 5 milk feeds to start with, and then gradually decrease the milk feed, and 2 to 4 solid feeds. So this is a rough timetable. You can't militarize it, but you can use it to guide yourself. So suppose the child, when the child awakens, you give them the first milk feed. At 10 a.m., you can give a breakfast. That is again a dal rice combination or a suji or whatever. Then at 1 p.m. lunch, 4 p.m. again afternoon milk feed, or plus minus if the child is a little older at 7 to 8 months, you can give a snack like a fruit to eat or something else. 7 p.m. dinner, and then before bedtime, one more milk feed. This is again a rough guideline. The main thing to remember in this schedule is that milk feed should be at milk time and not at the main principal meals time. So three principal meals should go as meals, not as milk feeds. So breakfast, lunch, and dinner should be going solid feeds only, not milk. Bacha ro raha hai, humne de diya. That's not how you're going to introduce solid foods, because then it will be a tedious effect for you as well as your child. Now, how much to give? A lot of parents ask how much to give. Again, individualized quantity. You can't expect a completely breastfeeding child to suddenly start eating from a plate. That is outrageously incorrect. You start with 1 spoon or two. 1 spoon or two is for them, it's a meal. So you start with the 1 or 2 teaspoons or normal spoons, then gradually increase the quantity to small cup, and then a vati, normal vati, which is around say 100 150 ml. You have to respect the child's appetite. You have to learn to take signals from the child. Stop if the baby is not interested, he's turning away the mouth from the feeds. And you have to accept that some babies will accept the foods regularly and readily, others will take their time, sometimes even 7 to 8 months. And there is another thing, water becomes essential. Once you start solid feeds, water becomes essential. Till now, what was happening was breastfeeding had 70% water. Now, water becomes an essential quantity or an essential item in their feeding. So you have to offer. And one thing you have to understand is water is tasteless. So till now, mother's milk was very tasty, very sweet. So they were taking readily. Water they will not accept readily. You have to keep trying, be patient, give 2 sips at a time. That's also okay. But they have to have water after every meal, not with the meals, but after meals. All right. Also, so the other thing is that baby stool patterns will change. They will start passing more stool. They will start passing more watery or more mucousy stools, or they will start passing it more often. You don't have to get scared as a parent that that's not loose motion. That is just them getting used to the new food items that you have delivered. All right. Let's move on to what solids do we have already discussed what solids do we give. Now what solids to avoid. So what solids to avoid, in the sense you have to avoid each and every small thing that can cause a foreign body obstruction. Either can go into the nose, or they can put it into their ears, or they can, it can lodge in the throat and cause choking and suffocation. So chana, pomegranate seeds, uh, groundnut, any other things that can be lodged if I'm mistaken, that should be avoided to given. And super added salt and sugar till they are, and honey till they are 1 year of age should be avoided, and non-vegetarian food, because they will not be able to digest non-veg food till they are 1 year old. Also, a lot of people ask me, when can we start fresh milk, cows or buffalo milk? So buffalo milk and cow milk should be started only and only after 1 year of completed age. For after first birthday, you can start this. And to sweeten, ideally sweetening should not be done. But if you want to still sweeten the wheat, use jaggery instead of sugar. Okay. Having said and having talked about what are the things to be done, what to be given, how to be given, and how many times to be given. So now we have to discuss about, I would like to discuss about mealtime manners, or how do you make mealtime fun. Once again. So mealtime, approximately, you don't have to run around the child all the time for 2 to 3 hours. Meal time should not be more than 30 minutes. At least the major meals. The three major meals, breakfast, lunch, and dinner, should be only 30 minutes. No running around after 30 minutes. Keep the child as it is after 30 minutes. If he eats also, there is very less advantage of them eating that food. And the snack meals, maximum 10 minutes to 12 minutes, not more than that. All right. You have to make sure that meal time is fun for the child as well as for you. So you make it a priority to eat with your young child. Make sure you have at least half an hour every 6 hours, that is breakfast, lunch, and dinner, for your child. Sit with him, share your stories, how you started, how you enjoy the meals, tell him stories, him or her, stories of foods, get them attracted to the color, smell, taste, sight of food, whatever you eat at home. Right? Provide nutritious and tasty options, and let the children decide from that options only. Because बच्चा खा नहीं रहा है, you give milk feed, बच्चा खा नहीं रहा है, you give them junk food. That's not how weaning happens. uh, there should be no coaxing, no forcing, or no cajoling to be for them to eat. You don't have to target quantity. 2 spoons full of quality food is also enough. Make sure that this time from 6 months to 1 year of age, 6 months to 1 year of age is the time when they have to learn eating. They are not supposed to gain weight. They might in fact lose weight. That's okay. You just have to go slowly and increase gas gradually. You have to be consistent. You have to make sure that that environment that they are eating in is consistent and predictable. And it has to be like a routine. 7 बजे खाना खाना है तो खाना है. Everybody has to be there at the dining table at 7 o'clock. Make it fun for him, make it an interactive session, talk to him, as I said, encourage him to self feed when he eats nice food, compliment him, and you also enjoy your meal so that your child can see and learn from you. Be a active role model. The most important thing is no screens during the feeding time. No TV, no mobile phones, no laptops, no iPads, no nothing. So when it's meal time, they have to eat, enjoy, see what they are eating, and chew properly and digest it. All right. So I think we have come to the end of the session. I think we have discussed everything up till now. How to introduce solid foods at 5 to 6 months, what to give, what not to give. How do you make meal time as a pleasant time and not a war? So now I would like to tell you in short about this session, just a few take-home messages. So introduction of solids to a child is a gradual process. It doesn't happen like this. It's a slow process. You can start at 5 to 6 months. The goal is at 1 year he should be able to eat from the family basket or the staple family diet. It should be individualized for each baby. It's not a military schedule. It should be fun and exciting, and it should not be a battle. I can't reiterate that point more. You basically go from thinnest to the thickest quality. So you go from dal water to thickened dal, then dal rice combination, and hence so like that. Similarly with soups and everything. right? Avoid salt, sugar, and honey till 1 year of age. Avoid fresh milk, that is cow buffalo milk, till 1 year of age. After that, you can introduce same with non-vegetarian food. You can start with soups of non-veg and then start again. Make your meal time with your child your priority, because if you don't, then they will not, and then it's going to be a vicious cycle of growth failure and everything. Okay, and most important, I can't again emphasize on this point more: no screens during meal time. All right, no screens at all during meal time. So that's it about how to introduce solid foods to your child from my side. This is Dr. Rushit Shah signing off. If you have any questions, I'll take questions now. Takeaway messages, as I already said, takeaway messages will be that you as a parent also should enjoy the weaning and make sure that you introduce from liquids to solids and individualize it. Individual, and no comparing your child to other child. मेरा बच्चा नहीं खाता है, दूसरा बच्चे का वजन देखो. No comparing. Comparison never gives you happy results. Comparison will only make you miserable. Uh, Also, at the end, I would like to say that you can follow me on Baby Chakra using my referral code. Thank you very much for your time. Thanks a lot.